Hi everybody, I'm Rob Scafidi, diagnostic microbiologist and medical researcher. Today we'll be talking about a clinical skills workshop that is directed at clinical lab scientists in improving delivery of services. The background and context to this is that recently in the last few decades there's been a significant increase in analytical errors performed within the clinical lab. This extends to clinical bacteriology, which is through the identification of gram-positive and negative bacteria as well as other pathogens, and immunology, where we've had incorrect setup of assay and agglutination testing and step-by-step protocols not being performed correctly. Furthermore, evidence has shown that the majority of these errors occur within the total testing process, or the TTP, not just in the analytical phases. Pedagogy, increasing digitization, pandemics such as COVID-19, and laboratory automation have revolutionized the clinical sciences sector. However, these errors must be addressed, lest there's a consequence of less than ideal patient-centric care. Furthermore, advantages of addressing these errors include a reduction in expenses that have been utilized along the way and improvements to overall patient prognostic and diagnostic care and findings. Thus, there's a need to investigate and improve the delivery of these clinical diagnostic care services to our patients. How do we do this? Well, we initiate change through fundamentally investing in the underpinnings of science. These are the theory and practical bases. This is done through Bloom's cognitive theory of knowledge, comprehension, and delivery, and we can achieve this through practical-based informative clinical workshops directed at theoretical knowledge delivered by expert clinicians and academics in the field, practical knowledge gained by case-specific scenarios that I'll speak a little bit about, and expectation of the clinical guidelines and frameworks to be followed in the workplace. These practical seminar workshops are used, but limitedly. This is a unique combination of traditional didactic learning with the unique inclusion of complete case-specific scenario discussions and practicals, HbA1c testing, for example, or angio testing, converting testing, clinical microbiology of specimens, and experts available to educate, reinforce, and provide this up-to-date information to our students and scientists. Furthermore, this can be done in a multimodal context, being run locally in class or digitally over Teams or other platforms. There are various facilitators through this approach. It's a person approach, which is the knowledge, understanding, comprehension stem from the individual competency of the person or the scientist. We can achieve this through expert guidance and mentorship with this program, through clear directed objectives being stated of procedures and testing protocols, as well as sharing of best practice amongst colleagues, through a legal or clinical framework approach, which is the responsibility of the clinical decision based on the scientist, adopted by the ASM or the AIMS guidelines that direct their judgment and their action. We can allow for current and ongoing education regarding these clinical protocols and guidelines to be applicable to hospital lab environments within these seminars, and furthermore adopt a duty of care statement indicating roles and responsibilities of scientists to our patients, and a system-based approach which is contemporary in nature, but it addresses the challenges in clinical science, digitization, evolving innovations, and novel testing techniques. All of this leads to a guidance and mentorship program that overarches this seminar skills and practical basis workshop. There are certain barriers to innovation, and these are the strategies of which we'll attempt to use to address these barriers. One is the complexity of procedures and total testing process. We can provide expert knowledge and a step-by-step protocol that the scientists can then adopt. Boundary professionalism refers to ensuring that there are clear directives from management of the duty, roles, and responsibilities of our scientists, reinforced through this leadership training module. Workforce shortages, not an easy issue to address, but we can use surveys and questionnaires directed at employees and management to seek additional concerns, if there are any, and increasing demand of procedures. We can do this through providing a clear prioritization method or methodology, which is delivered through the clinical skills workshops and ongoing leadership and mentorship programs, as well as ensuring adequate funding to address the financial and monetary limitations and barriers. Thank you for listening.